Good morning, everybody. In the beginning, I'd like to thank Dr. Vaibhav, Dr. Mohan Desai for inviting me for this talk on operation room setup. Um this is my overview, like what is the operator room setup regarding the robot, where you keep it, where the surgeon stands. Then robot system, we have a Merrill system, Covis. What are the various armamentarium and devices, how you do your robot draping, calibration, how you position, and what are the probe and frame system. We are very lucky to have our state-of-art Robotics, thanks to Dr. Mohan Desai, who was instrumental to make this within stipulated time period. I will not go into details like how much is the temperature, humidity, and pressure, but only thing is I would like to know that I would like to tell you that if there is some amount of power failure or something, but before starting the robot, please check, because there might be moisture or condensation for which you might have to wait till it dries up. So please be careful about it. And these are the robot, like they have a monitor with OTS, that is optical tracking system, and there is a robotic arm along with the main controller. This is a remote which is usually with the assistant. They are the like company guys who hold it outside the field, and basically they capture the registration. Whatever you tell them, they will capture it. These are the miller of our robot, with allowing to do precision of the bone cuts. A short video about it. The various armamentarium we need to know about it, like leg positioning device, foot holding device, distractor system, sensors, robot attachment handle, robot probe, and various tibial and femoral sensors, areas, and frames. So let us go one by one. This is the leg positioning device. This is very important. It fixes the leg and ankle foot to the table. Now, this is the table attachment. Very important point is that we need to have to put it on the side of the operating procedure. Plus the draping, there should be less of draping over this, because if you do a lot of drapings, that this attachment handle won't sit properly, and it will be like unstable one, and the robot will not function if the leg is moving, or sometimes happens the patient is light because of anesthetic point of view, or you have not fixed it properly. If it moves while doing it, then the robot will not function, it will stop there and there. You can use this on bilateral side also. You have to remove this and attach it on the other side when you have to do the other side also. This is the foot holding frame. This has got slots. This is for the attachment of the distractor. Okay, this is the attachment to the leg holding device. This Both these things, like leg holding and foot holding device, they keep the leg in stable position, and because of that, this ball arrangement, you can make the leg into internal rotation or external rotation, because you have to be in connection, in direct contact with the OTS. So you can arrange this with this. This is a handle lock where you can just do extension flexion with this. This is the distractor we use. It depends on whether they want to use or they don't want to use. Basically, if you don't want to use, it's fine. If you want to use, you can use it at any time, before registration or after registration, before allowing the robot to start taking precision cuts. So this has got the handle. This is for the foot frame attachment, and this is the distractor handle. Basically, you can remove it any time. If you don't want to, like, you have to check your reflection extension, you can remove it at the same time. I am using it after doing the registration of the bone. This is the distractor foot frame assembly, and this is the total assembly. I use it because I need to go to the medial posterolateral corner where the bone cuts are there and they remain inside only. And this is the attachment handle. The robot attaches to the knee of the patient. How is it done? It is by the femoral tibial pin. You can use pin or you can use the clamps which the company provide us. You can use either of these, and the distance between these two, like femoral and tibial pin, should be at least around 20 centimeters. Well, this is the maximum handle which can hold it. This is the way robot attachment handle is attached. So let us go to the draping. There are like two drapes. First is the robotic arm which has to be draped. and secondly, it is the controller which has to be draped. So this is the final draping of the robot. These are the sensors which I need to attach. We require at least 12, but we have to keep extra also because these are very sensitive. If some amount of blood or water spills over it, then the sensors won't be like detected. Also, some amount of scratch or something, we have to replace it immediately. This is the robotic frame, tibial, femur and tibial frame with sensors. This is the way it is attached. This is the probe which we use like for registration of the bone, for registration of the robot. And this is the calibration of the robotic arm. This is usually done by the company people. This is the way we have to register the robot, calibrate the robot. Once the robot and robotic arm is calibrated, then we shift the robot to the surgeon side. Robotic arm is shifted to the surgeon side, like it is behind the surgeon. So once the surgeon moves out after taking exposure and out, he moves out from there, then robot is directly in opposite to OTS. This is the probe calibration for the miller. That is our for taking cuts. This is the bone cutting, precision cutting by the miller. This is the irrigation system which is also being supplied at the same time when the bone is being cut. There's a continuous flow of the fluid, saline is there. This is the final picture, like all things, robotic frame, robotic handle, burr irrigation system, femur and tibial frame. This is one of the x-rays of my patient. I thank you all for your attention. This is very important because we are the operating surgeons, we are the leaders. So these most of the things are being done by the company guys. But we should know what they are doing and how properly they are being like draped and everything, and to get it to the right position for the surgery to take place. Thank you.